Sir, my name is Dr. Biplab Jamatia. Sir, we read about the Barker hypothesis where it was suggested that the root cause of the cardiovascular or the non-communicable disease is started from the fetal age, which was basically experimented in the Scandinavian country. So is it also applicable to the Indian population where the large percentage of our mother are particularly not in a good nutrition status and they are anemic or they are malnourished? And is this Barker hypothesis is coming true for the Indian context or some other developing country also?
So I think what has emerged is that yes, the maternal malnutrition plays a role in the overall health of the child and future cardiovascular diseases, but it's very difficult to establish one-to-one role in it. What we have seen very clearly is that in Indian setup and in the subcontinent, there is a conglomeration or accumulation of risk factors. Even the Inter-Heart study, which was done in nearly 15,000 patients in 42 countries, has clearly shown that out of the 9 risk factors, if you look at the Indian subset, there is an accumulation of the risk factors, like simple things like fruits and vegetables in your diet, physical activity, psychosocial stress. Now, these are very difficult to map. You can pick up hypertension, diabetes, high cholesterol, smoking, family history, etc. So I think what you're looking at, and the whole idea of giving you that much data, is also to sensitize you that health is no longer cardiovascular or respiratory or mental. It's a kind of a holistic issue that we're dealing with. If you don't have a healthy mind, you're not going to exercise. You're going to use food as a comfort food, that's your mental issue. Obesity is more mental than physical. And that is going to lead to diabetes, hypertension, heart disease in the next 10 to 15 years. So what we are saying is that you catch them young, right in the childhood, as Dr. Samir is saying that you don't have counselors in the schools. You catch them young, you get them into a good habit, sensitize that this is going to land you in trouble as you grow older. And I think that's the way forward.
Thank you, sir. Thank you.
And what we are seeing is inflammation. So there is a plaque rupture in all these young guys who are dying young. The mechanism of heart attacks is plaque rupture. So even if you have an 80-90% block in a farmer in a remote village, the plaque may never rupture. They may have angina and dyspnea, but they may never have heart attacks. But a young guy may have a 50% plaque which ruptures, blocks the artery suddenly and gets a heart attack. So you need to prevent the plaque rupture by your lifestyle measures.
I'm Dr. Tembe. What was your experience regarding the incidence of cardiac conditions during COVID? And how do you see that?
Yeah, so that's a very good question, and I think Dr. Guleria did elaborate on it partially. See, I'm a cardiologist, and I'm also a clinical cardiologist with a lot of imaging, which I do. So what we did come across was a lot of asymptomatic cardiac dysfunction. So just like any other viral diseases, you would have young guys or even old people coming in with typical COVID scenario, recovering from it, and then with the left ventricular dysfunction, the ejection fraction or the pumping of the heart is less. They may come with heart failure, they may come with exacerbation of a pre-existing cardiac disease. Some of them landed with acute MIs, strokes. Some incidents could be potentially attributed to vaccine, but then they were really, really few and far in between. So yes, we did come across a lot of cardiac issues. Yeah.
I think in the interest of the time, we'll just take the last question.
Yeah. So my name is Dr. Ramanjit. I work with Hindustan Unilever. So India is the capital of heart diseases. And if we talk about India, the North India is the hub. So, I mean, what are the major reasons? Is it the anatomical variation in the coronaries, or you feel the diet and other contributing factors play the major role?
So I specifically showed you data about the regional non-communicable disease spectrum across India. And India, each state is different, right? You cannot, in fact, South India has higher conglomeration or accumulation of risk factors which lead to heart disease. More than 3 risk factors 18% is seen in South India as compared to 13% in North India. The problem is that in India, it's very difficult to capture data. Who is getting more heart attacks, strokes, etc. The other problem is that access to medical care. Do they reach in time to the hospital? Half of them would never reach the hospital and have a sudden cardiac death at home, arrhythmias, etc. But it is not just North India which is reeling from that. So hypertension is equal in North and South India. South India has more of CVD actually as compared to North India. More tobacco and alcohol use in Northeast India. So India is a it's a unique country in a way that each area, each part of India is having different, manifestations.